Are you fond of drinking cups of coffee in a day? Are you in doubt as to whether it is harming your kidneys or offering some extraordinary benefits? Well, it's obvious to have such doubts in mind if you or your loved one has any kidney disease. Well, in today's video, I will discuss whether you should drink coffee or not if you have kidney disease. I will also suggest some science-backed research which will help you give a clear out whether you should drink it or not. Well, if you think cups of coffee might improve your kidney functions, or you just go by its benefits and think it can help you with your chronic kidney disease, then you might be wrong without knowing what some research says about this. Well, let's first understand what your coffee contains. I mean, what chemical compounds is coffee full of? A regular cup of coffee is packed with caffeine, a natural stimulant that boosts alertness, chlorogenic acid, an anti-inflammatory, trigonellin, diterpenes, melanoidins, and small amounts of potassium, magnesium, and niacin. But how do these compounds interact with kidney health, especially when your kidneys are already under stress? Okay, so let's understand kidney disease. Kidney disease occurs when your kidneys lose their ability to filter waste and maintain fluid and electrolyte balance. In the early stages of CKD, people often don't feel symptoms. As the disease progresses, problems like fluid retention, high potassium levels, and high blood pressure can occur. You know that there are 850 million people around the world who are suffering from some form of kidney disease. 1 in 7 adults in the US has CKD, and many of them are unaware and undiagnosed. So, should someone with compromised kidney function avoid coffee completely? Well, you need first to understand what research says about this. A 2022 study in the Kidney International Reports journal found that moderate coffee consumption was associated with a lower risk of kidney function decline in the general population. A 2018 review in Nephrology Dialysis Transplantation revealed that coffee consumption wasn't linked to increased risk of CKD, and may even protect against it, thanks to coffee's antioxidant content. But here's the twist: while moderate intake can be protective, excessive coffee, especially with additives like sugar, milk, and cream, can have adverse effects. What should be the recommended amount of coffee you can have if you have chronic kidney disease? See, caffeine is processed through the kidneys, and in excess, it can be a diuretic. That means it can lead to dehydration, dangerous for someone with CKD. If you are a coffee addict, you must limit caffeine to 200 to 300 milligrams per day. I mean, you can have 1 to 2 standard cups of brewed coffee. You should avoid the intake of energy drinks, which are full of sugar, additives, and artificial flavors. If you still doubt that you may have a problem with coffee, even in smaller amounts, then you must notice symptoms like increased urination, dry mouth, or dehydration. But do you know there is a benefit to drinking plain coffee? Black coffee has very little sodium or potassium, so it's often safe when taken plain. Well, let's know the benefits of drinking moderate coffee, as several research indicates its benefits. Let's know what they could be. It may improve insulin sensitivity. It lowers the risks of diabetes, which could be the reason for diabetic nephropathy. Coffee protects brain function and reduces the risk of Parkinson's and Alzheimer's. It slows down inflammation. Hence, it is good for cardiovascular and kidney health. It is rich in antioxidants like chlorogenic acids, which help reduce oxidative stress in the kidneys. Well, you will be surprised to know that a 2021 study in clinical nutrition found that moderate coffee drinkers had a 24% reduced risk of CKD progression compared to non-drinkers. I know it's very pleasing for your coffee drinkers. But it's all based on the research. Well, it's all about the benefits of moderate coffee intake, but the question is when you must avoid drinking coffee in a moderate amount. Here's when coffee may not be safe for kidney patients. You must avoid it in advanced kidney disease, stage 4 or 5. Why? In this stage, your kidneys struggle to excrete potassium. Some coffee with high fat and sugar can be higher in potassium. Milk and creamers can increase potassium and phosphorus levels, whereas sugar can increase the risk for diabetes, a major CKD contributor. On the other hand, unfiltered coffee, like French press, contains caffeine, which may increase cholesterol levels, a risk factor for heart disease and hypertension. So, the final question is coffee safe for kidney disease? The answer is yes, if taken in moderation, with no additives, sugar and high fat, and plus you need to monitor your GFR and creatinine while consuming it so as to avoid any unintentional